Good evening, guys, and today our topic is the femur. I have discussed the hip bone in detail, and you can see in the anatomy playlist. So let's get started. First of all, the length. A femur is 45 centimeters in length, and it is one of the largest bone and longest bone in the body, and it is the number one. It is longest bone. All the long bone consist of the ends and the shaft. So let's see. This is the anterior view and this is the posterior view of femur. Okay. So the upper end consists of the head. It consists of head. Head is directed upwards and it is directed medially. Medially means that it is directed towards the midline of the body. The neck consists the length of 5 centimeters. Okay, it is 5 centimeters and it forms an angle of 125 degrees with the shaft of the femur. The greater trochanter, it is like a bony projection, and a lesser trochanter. The feature of the greater trochanter is that it contains trochanteric fossa. When we see in the medial aspect, medially, it contains a trochanteric fossa. Okay, the other two terms that I need to mention here is that both of these trochanters are connected anteriorly by the intertrochanteric line and posteriorly by the intertrochanteric crest. Okay, the intertrochanteric line connects them anteriorly, and the crest connects the both trochanters posteriorly. And the intertrochanteric crest consists of a tubercle known as the quadrate tubercle. The significance of the tubercles are that they provide site for the muscle attachments. So let's revise the upper end. It consists of head directed medially and upwards, the neck 5 centimeters and form 125 degrees with the shaft. Greater trochanter consists of sorry, trochanteric fossa medially and the lesser trochanter. Both these are connected anteriorly by intertrochanteric line and posteriorly by the intertrochanteric crest, which contains quadrate tubercle for the muscle attachment. And the lower end. Lower end consists of condyles. Okay, condyles. So let's focus on the lower end. It consists of the lateral condyle and the medial condyles. The medial condyle, as you can see in this diagram clearly, that it is directed more downwards than the lateral condyle, and both these condyle also contain epicondyles. Epicondyles are the areas which are slightly upwards to the condyles. So these are the epicondyles, this one, and these are the condyles. Okay. So, and two other things I want to mention here is that there are two surfaces, the intercondylar fossa, and the patellar surface, this one. But the difference between them is that the patellar surface is located anteriorly where the patellar bone is located, and the intercondylar fossa is located posteriorly. Okay, and the medial epicondyle also contains adductor tubercle. As I have mentioned that the tubercles significant is that it provides muscle attachment, right? So adductor tubercle provides the attachment to the adductor magnus muscle. We'll discuss the muscle attachment in a minute. Okay, so this one was quadrate tubercle and this is the adductor tubercle. Okay, and the lateral condyle consists of a popliteal groove. What is a popliteal groove? In this diagram, so this is the lateral condyle, and this is lateral condyle, and this is the medial condyle. It has the groove. It has a groove which serve as the site for the passing of the popliteus muscle. So it is the popliteal groove. It is the importance in the lateral condyle. Okay, let's move towards the shaft. The shaft. The shaft in cross section, not in anterior or posterior view, but in cross section, it looks like a triangle. This one. This is a triangle, and triangle consists of borders and surfaces. So it has three borders. It has medial border, lateral borders, and the anterior border. And the surfaces: posterior medial surface, posterior lateral surface, and the anterior surface. The one important thing in the borders of the shaft is the linea aspera. Linea aspera is the posterior border of the shaft, and it is significant because it provides site for the muscle attachments. So this is the linea aspera. It consists of two lips. It consists of medial lip and the lateral lip. So here you can see that this is the linea aspera, and it consists of this lip, and it consists of this lip, the lateral, the medial, and the lateral lip. So both of these lips are anatomically important, and so let's talk about them. Medial lip is continuous superiorly with the pectineal line. This is the pectineal line or the spiral line, and the lateral lip is continuous superiorly with the gluteal tuberosity. Okay, medial lip is continuous with the spiral line or pectineal line, and the lateral lip is continuous superiorly with the gluteal tuberosity, as you can see here. Spiral line on medial aspect and gluteal tuberosity on the lateral aspect. And inferiorly, they are both continuous with the supracondylar ridges, or the medial and lateral respectively. So what does it means? It means that, just a moment. For example, this is the posterior view, and the linea aspera is only visible posteriorly. So this one was the medial lip of the linea aspera. So inferiorly, it is continuous with the medial supracondylar line or ridge, and the lateral lip is continuous with the lateral supracondylar line or ridge. Okay, so let's talk about the articulations. Hmm. Articulations means that the parts of the femur which form joints. First of all is the head of the femur. It articulates with the acetabulum. Acetabulum is the area of the hip bone, and it is the circular area that connects the three of the bones like ilium, ischium, and pubis. The head of the femur fits in the acetabular fossa. Okay, so it forms the hip joint. The second joint is that the condyles of the femur connects with the condyles of tibia and patella to form the knee joint. Okay, so these are two joints which have significant in the articulation of the femur. First is the hip joint, which is the ball and socket joint, and the second is the knee joint, which is the synovial type of hinge joint. As you can see here, the femoral head is fitted in the acetabulum, which is like a socket. The next thing I want to mention here is the ligamentum teres. Ligamentum teres, or the ligament of the head of the femur. There is a depression in the head which is known as the fovea. Okay, I don't know, I have mentioned it in the, oh, okay, this is this is the fovea. Fovea is the depression in the head of the femur, and it is the site where the ligamentum teres arises. Fovea give attachment to ligamentum teres. It is also known as round ligament or the ligament of head of femur. The function of this ligament is to connect the head of femur to the acetabular notch. This is the acetabular notch, okay? Acetabular notch, and this is the acetabular labrum. So, and the second important function of this ligament, it is that it carries acetabular artery from obturator artery to supply the head of femur in children, but it lost its function in the adults. So what are the two main functions of ligamentum teres? The first one is it connects the femoral head to the acetabular notch. The second is that it contain or it supplies the way for the acetabular artery, which is the branch of the obturator arteries, to supply the head of the femur, but only in the children, not in the adults. So, talking about the arterial supply, so we can discuss a bit in detail. There are two arterial supply. First is the main, and second is the, as we have discussed just a minute before, the acetabular artery from the obturator artery. The main supply of the head of femur is from the retinacular arteries. Retinacular arteries arises from the medial circumflex femoral artery, which is the branch of profunda femoris. In this diagram, you can appreciate that from the femoral artery, from the femoral artery arises the deep femoral artery, and from deep femoral artery arises the medial circumflex femoral artery, and from that arises the retinacular arteries, which supplies the head of femur. As you can see that they branches off to supply the head of femur, and in conditions when these arteries are cut down in case of fracture or any trauma, it results in the necrosis of the head of femur, and it is a very severe condition. Okay, so till now we have discussed some bony structures of the femur, the ligamentum teres, the arterial supply of femur, and the sum of the articulations. I hope the important points, high yield points, are clear to you all. And in the next lecture, the part 2 of the femur, we will discuss the muscle attachments. I am not discussing it right now because they are very comprehensive. So just wait for the next lecture and I will discuss them in the next video. Okay. I hope you understand all this, and you can take the screenshot if you want, and you can revise it from here. So, okay, I will meet you in the next video. Till then, goodbye.